Joining us now with more on the topic of Michael Miller, a professor of economics at DePaul University. Good morning. Thank you for joining us.
Good morning.
What are your thoughts on the different statements from the administration on the prognosis for the economy in the immediate future?
Well, there's no good news at the moment. All the news I have seen shows that unemployment is probably around 20%. The fall in GDP is probably about 25%. Both of those would essentially be records for the past 70 years. I can only hope that it will be short-lived. It is good news that some of the states are starting to allow people to go back to work. But there's something we call the multiplier effect. And when one shuts down, like you have something shutting down in packaging pork, and then all of a sudden that means that affects pork, pig farmers and so forth. And it just ripples down through the economy.
Let's talk about the stock market. Interestingly enough, it's up 29% from the low about a month ago, and it's only 16% off the all-time high.
Sure.
About a month ago, we thought, oh, this is just going to be a ride to the bottom, and it's rebounding. What is the cause of that?
Well, I would think what we're seeing here is that people feel that in the long run, stocks are still a good buy. Of course, stock prices are based upon information, and their belief must be that firms are going to be relatively profitable after this horrible summer. Because remember, they're not buying for tomorrow, they're buying for the long haul. And stocks are still a good investment.
They talked about a V curve in the beginning. Now it's more of a U rebound, and who knows how long the bottom of that U is. But I'm wondering if an economist like yourself looks at the psychology of behavior and how people might react when this is all over about spending money and what activities they do.
Well, we can hope that people will, they have pent up demand, that they're going to go out there and start doing some things. That would be good. The idea of a V-shaped recovery, if this had only lasted, say, 3 or 4 weeks, that probably would have been the case. But now that we've lasted this long, and in Illinois, we're going to go probably another whole month, this is going to cause the recession to be longer than we thought, maybe 2 to 3 quarters as opposed to 1 to 2 quarters. And so it's going to be longer before we're getting anywhere near back to normal.
We hear the word depression. Compare it to the actual depression of the 1930s. Is that what we're in?
In terms of the actual change in GDP, you would use the word depression because you figure anything with a double-digit decline in the economy would be so out of the ordinary that it must be a depression. The one big difference is during the Great Depression of the 1930s, there were no social programs, no social safety net to help people. So what we're seeing now is that the decline in GDP will be substantial, but it should be relatively short, and people will not be starving and being thrown out of their homes the way we were in the 1930s.
And are you concerned about the deficit? Does this mean taxes in the future, or how do you balance that out?
Yeah, there's no doubt that the deficit is going to rise. It's up, I heard, by $1 trillion already, and there's already $2 more trillion baked into the pie, and that's on top of the nearly $1 trillion we were going to run in the first place. So this will be an enormous, unprecedented deficit. But when you're in a battle like this, you don't worry about it as much in the short run. But clearly, you and I are going to have to pay for this. We will be paying in terms of the amount of taxes we have to pay to service this debt. And when interest rates begin to rise, say a year or 2 or 3 from now, towards more normal levels, the amount we have to pay the interest on the debt will be quite a burden.
All right. Well, Michael Miller, thanks so much for joining us this morning. We appreciate it.
Sure. My pleasure.